My name's Dr. Paul Tumbu. I'm the Senior Technical Advisor for Malaria Action Program for districts. And I am here to present some of the results of our project and effective malaria diagnosis and treatment is one of the key result areas of this project. Some of the key messages here is that health worker mentorship rather than off-site training has proved to be very effective, and it does not disrupt the work at the health facilities. We also know that there is no malaria death which is acceptable. Malaria mortality and clinical audits is very effective for improving case management at health facilities. The use of community and health facility data to identify higher risk communities and households is very useful for timely intervention. A holistic healthcare approach which spans from health facility to community, including the community case management, ensures appropriate interventions at the community for malaria. Improved malaria diagnostics improves the management, the case management of malaria and decision making for proper treatment. Community transformative action-based social behavior change is very useful as compared to the top-down communication approaches. We employed a number of key approaches in the implementation of this project, and one of them is that we used central and district level capacity building approach, mainly using the training of trainers for the district and regional and national trainers, including the audit teams. And as a result, 48% of the health workers at the end of the project had been certified by World Health Organization as laboratory microscopists. We also supported the districts to implement the integrated community case management of malaria using the donut approach, and we promoted this donut approach for management of malaria in the community, and it was finally integrated into the Uganda Ministry of Health Malaria Reduction and Elimination Strategic Plan. We improved the national and district procurement processes. We also provided the ICCM VHTs with equipment and tools that they were using for implementation of malaria strategies within the communities. And together with the MasterCard Foundation, we were able to train VHTs, and we provided them with PPEs, especially at the peak of the COVID-19 pandemic, for continuation of essential services. We institutionalized the clinical and the mortality audit in especially the high volume health facilities, the hospitals and the health center FOS. And this is mainly to improve the quality of service delivery and adherence to the standard guidelines. We also strengthened the private sector integration of malaria services and capacity building, mainly using the health professional bodies like the Uganda Medical Association and the Uganda Pediatric Association. We supported and strengthened data-based targeted actions through effective use of data to influence decision-making by the health workers for malaria case management practices. We also improved the data use for planning, and we supported responses for flood-affected areas. In some of the districts, we strengthened the stock supply system. We employed data-based, gender and age-sensitive, transformative, action-based social behavior change, especially in the districts of Kayunga and Yumbe. And we also supported the health worker and the health facility capacity building through dissemination and provision of standard malaria case management guidelines and job aids. We also integrated the mentorship and support supervision using the district structures like the district health management teams and the technical resource persons who are based at the district. We also strengthened external quality assurance and diagnostic proficiency testing in all our districts. We institutionalized quality improvement management systems and functionalized quality improvement teams in health facilities. We supported off-site capacity building and support. And as a result of all these integrated approaches, we were able to achieve the goal of the project of reducing morbidity and mortality due to malaria in Uganda, as evidenced by the improvement in the indicators. For example, the proportion of malaria negative cases who are treated with antimalarials reduced from 47% in program year 1 to 2% in program year 5. In conclusion, MAPD as a project successfully supported districts to continually improve malaria indicators over the 5 years, and we therefore recommend that the government of Uganda and other actors should continue to support districts to implement the strategies that have been put in place and monitor the post-MAPD sustainability plans. We also recommend that the technical resource persons at the district should continue mentorship and data analysis approaches to be prioritized for continuity. Our recommendations also that methods of improving community data inclusion should be investigated and strengthened. Thank you very much for listening to me. For God and my country.